Well, today we are at Spring Fertility, and I am so very excited to talk about this subject matter. We're talking about fertility. Welcome to the show. How are you?
Thank you. I'm very well. How are you? Thanks for having me.
Lovely office, really nice place.
Thank you.
So Spring Fertility specializes in what? What is it that you do here?
So we do everything related to reproductive medicine. We preserve fertility. So we freeze eggs, we can freeze embryos. We do IVF for couples who are trying to get pregnant and conceive. Likewise, we do intrauterine inseminations or IUIs, and we do the full gamut of fertility workup as well, all in this office.
What is a common misconception or perceived misconception that people have?
Yeah, that's a great question. So common misconception is that the number of overall eggs you have is related to your ability to just spontaneously get pregnant. That's not true. They're separate ideas. So every month, your ovary ovulates one egg, and that egg either gets fertilized and turns into a pregnancy, or it doesn't, and you get your period. What we do here is look at what's called the ovarian reserve. It's like a snapshot of all of the eggs that we might not be able to see that are sort of in a vault in your ovaries. And that number that we look at on ultrasound, that we get blood work to correlate with, that ovarian reserve is overall how many eggs you personally have and how many eggs we might be able to retrieve that's separate from your ability to get pregnant.
What is the average number of eggs that a person has?
That is probably not meant to be a hard question, but it's a very hard question because it really depends on each woman's biology. So some people have a lot of eggs in the vault and they have what we call a very high ovarian reserve. Some women don't have as many and it's a low ovarian reserve. On average, for a woman in their early 30s, there's probably somewhere in the mid-teens is what we'd call an average number. But again, that's very dependent on each person's biology.
Okay, so let's say the average family size is 3 or 4 children. Maybe it's 2, maybe it's 1 by now, right? Because people are having smaller families. So if you have 17,000 eggs, right, and you only want to have 3 children, right, what makes it so difficult to get those 17,000 eggs to participate?
It's crazy, right? When you think about it, why is this so hard?
Why is this so hard? So when someone's having some difficulty, or even if they're not, is there like an age now where people should maybe put some of their eggs aside?
Yes.
Okay.
So part of the reason why it's so hard to get pregnant later in life is because we're losing eggs our entire lives, starting from even when you're like a fetus inside your mom's uterus. We immediately start losing eggs. But the other thing that really changes after this magic age, I'm sure a lot of people have heard about, of 35, is that we have a change in the quality of our eggs. And so that can make it harder later on in life to get pregnant. And so your peak fertility really is in your 20s, early 30s. And so if you're thinking, I'm not sure if I want kids, I'm not sure how many I want, I would say late 20s, early 30s is probably the optimal time to consider preserving your fertility. Now, having said that, we have plenty of women who come to us all day, every day, who are older than that, who are unpartnered, aren't sure what their future holds for them in terms of children, how many, all of that. And so this is still something that's possible. And so I would say, because it's also individualized, it's worth coming and making an appointment and seeing with ultrasound and blood work what your fertility looks like today and if that's something that you should consider preserving for the future.
And how, do you take half? How do you know how many? Do you know what I'm saying? Keep some, maybe you're going to get pregnant naturally down the road. Don't freeze all of them. How do you decide the ratio?
In terms of number of eggs we're going to retrieve?
Yes.
So it's interesting because you're losing eggs always your whole entire life. So what we do here is we really capitalize on the wasteful part of our bodies, just losing eggs. So the eggs that we're retrieving are eggs that every month, and this sort of goes back to that idea of ovarian reserve and how many eggs you have, every month your ovaries offer forth a small cohort of eggs. These are the usable eggs for that month. Those are the eggs of which one is going to ovulate, and you'll either get it fertilized or have your period. The rest of them just get wasted.
Okay.
So what we do dissolve? Exactly, they disappear. And that's why we're losing eggs every month, which is so wasteful.
So you're not just losing one, you're losing
you're losing
5, 6, like a little neighborhood.
Exactly. And if you're someone who has a very high ovarian reserve, you're losing lots of eggs that month.
Really?
If you're someone who has a very low ovarian reserve, you're probably just losing a few. However many,
they're more precious to you.
Yes. However many the ovary felt like it could spare that month. These are usable eggs.
Isn't that amazing?
I
seriously,
think
when you
it's
went
the
to
best.
med school,
it's the coolest job ever.
I was going to say, so you learned a lot about this which made you be able to specialize and be so helpful, right? This is what your focus
That's the goal.
was.
This is what my focus was through medical training, yes.
Okay.
So the eggs that we're retrieving are not eggs that you were going to use in the future. They're eggs that we can preserve now that would have otherwise been wasted. So other misconceptions, some people ask if they're going to go through menopause earlier, are these eggs that could have been fertilized later on? The eggs that we're capturing now are eggs that were never going to be used. They were going to be wasted.
Okay.
And so we're taking advantage of the wasteful part of our biology and preserving it for the future.
Thank you for explaining that.
I hope it makes sense.
No,
it's sort of
the
a lot
first
to
time,
conceptualize.
No, it is. It's the first time I've ever heard that, and that makes a lot of sense. You know, my childbearing age is like, you know, it's way up there now. I would have to have a surrogate. I'd have to have an egg donor. I'd have to have a sperm donor. Anything's possible because I was 60 this year. But I'm happy with the children that I have. But I do have my own children now that it might be a concern for. And I know a lot of times people are, women are choosing careers now, career paths, and we're busy.
Yes,
we're just busy doing
absolutely.
other things instead of getting married in our 20s, having children in our 20s, and you know, it's just like different.
It's so true. And you shouldn't feel pressure because of our innate biology to have to plan your family any other way than how you want to because you have other aspirations like career, travel, whatever it is you might be doing. You should be able to do everything and have a family if and when you're ready.
I like the fact that you do help people from many different paths. So whatever their fertility path is, if they come to you, you can kind of help them navigate some different options.
That's the hope. And, you know, there's a lot of different ways to build a family. And so part of what we do is preserving fertility, but part of what we do is also helping couples build families however they see their family growing and developing. So we have single mothers who might be using donor sperm. We have same-sex couples. We use gestational carriers. We do all of that, the whole spectrum, donor egg, whatever someone feels like they need to build the family they want, that's what I want to be able to help them do.
And Spring Fertility has been around at least a decade, is that correct?
Yes, we are celebrating our 10th anniversary this year, actually.
Wonderful, congratulations.
Thank you very much.
Now, besides you, I know that there's another wonderful person here, Dr. Sullivan-Pyke.
Yes.
And I guess some of the things that you touched upon, we're going to talk a little bit more about. In particular, you mentioned something, is it IUI? Wait, is that? Okay.
That stands for intrauterine insemination.
Okay.
So it's basically where you come into the office and much like a pap smear, we use a speculum and we put the sperm directly into the uterus. So there are certain criteria for when we would recommend egg freezing, IVF, IUIs, for example. And so depending on what someone is looking for and what their infertility evaluation looks like will sort of determine what route of treatment we're going to take.
Excellent. Very nice to meet you. Stay tuned because we're going to have a more in-depth conversation coming up right now. Joining us now is Dr. Sullivan-Pyke, and we're going to be talking a little bit more about fertility at Spring Fertility. I like it here. You guys are all wonderful. I walked in through the threshold. I'm having a great time. I'm laughing so much. You're helping people have the family they've always wanted.
Yes.
What made you personally decide that this was going to be your path? Why did you decide to go into this?
Infertility is very near and dear to my heart. And, you know, actually growing up, I always had an affinity to women's health. I saw family members go through miscarriages, women have heavy bleeding, needing to take out their uterus for various reasons. And it just seemed like, wow, what can I do to help people through things like this? And how can we prevent people from having miscarriages? How can we help somebody really grow their family the way they wanted to? So that has always been there in my heart. And so, through varying experiences in medical school, residency, it was just the right fit.
Okay, you knew it was a calling for you.
It was a calling.
How has technology changed in recent years? What can you do now, or what did you learn about it that you're able to bring forth for your patients?
Right. So for overall infertility in particular, the most successful treatment option we have available is IVF, in vitro fertilization.
Okay.
And honestly, the first IVF baby was born in 1978.
Really?
Louise Brown. So pretty young field.
Yeah.
So as you can imagine, technology has dramatically changed throughout that period of time between 1978 and now. And so back then, we needed surgical procedure to extract eggs, which it was a little bit more involved. We had to put multiple embryos in the uterus in order to have live birth, and we're at risk of twins and triplets and things like that.
Octuplets. Is that a word? Is that the word?
Octuplets. That was a thing.
Okay.
We really don't do that anymore.
Okay.
So this field has evolved dramatically to the point of single embryo transfer, where we can fairly confidently put a single embryo into the uterus and have a happy, healthy singleton pregnancy and birth, and that's the goal generally. A lot of people will sit in my office and ask, oh, will I have twins? Will I have triplets? And I can generally assure them that really that's a very low risk. So that has changed significantly over the years. We have technology which actually allow us to do genetic testing on embryos to generally identify embryos that may have an imbalanced number of chromosomes that may increase the risk of miscarriage. And that can, once we, are able to select embryos with the balanced chromosomal number, we can do a transfer. And again, fairly confidently anticipate a lower miscarriage rate and, higher pregnancy rates for people.
Very interesting. So you could set that up almost like ahead of time by looking at how vital, the vitality, I guess, of an embryo.
Essentially,
you're like, that one's a good dancer. That one's looking good, right?
We can generally say that, this one has the right balance, and this one, unfortunately has an extra chromosome here or there. There's, a lot of conversation in the field about different things related to testing, but, ideally for people who essentially have a lot of miscarriages, that offers an opportunity.
Right. The emotion behind.
So hard.
Yeah.
Very,
I
very
had
hard.
friends that, went through so many heartbreaks. Just so it's hard.
Yeah.
It's
Absolutely.
really hard. So by the time they decide to even do IVF, knowing that sometimes now it's a little more successful is also great.
Yeah.
Because, sometimes somebody's like tried 3 or 4.
Exactly.
At what point, is there a point of like maybe not doing the process? If somebody's tried, how many times would you let somebody do IVF before you suggest something different? And what is the alternative?
Yeah, great question.
Okay.
And it all depends on that, basically that person and that couple.
So you kind of customize the journey.
Absolutely.
Okay.
Definitely personalized journey because everyone's different. Everyone's family goal is different. And age is a big factor as well. If we've tried multiple times and, there's poor egg quality, for example, something that happens as we get older, then at some point we may have a conversation about donor egg IVF.
Okay.
That is a part of the technology where we actually have eggs that have been either obtained fresh or frozen from generally women who's under 30 years old. And those frozen eggs or those fresh batch of eggs can be used with your partner's sperm or donor sperm to then make embryos. And you can transfer an embryo into your uterus, have a pregnancy, breastfeed that baby, that's your baby.
Okay.
Right? But that's another way of building your family if your own eggs with IVF have not yielded that outcome that you're looking for.
Isn't that wonderful? Do
incredible.
people send you pictures of the babies that have been born?
It's the best. It's absolutely the best. And that just gives me chills when you ask that question because I actually just got a picture a couple days ago.
Yes.
And it excites me every time. That's probably one of the best things about this field because you work really hard. You get to really know your patients.
Sorry, but I get it.
I know.
I get it.
It's just the joy at the end of the day when, you're able to help someone build a new
It all starts with
family.
not a possibility, and then you're giving them a possibility, and then it's a reality.
Absolutely.
So that got me. Really, I used to work for an OBGYN, and I would go over to the hospital before computers. And when the baby was born, we would write down the names and what the sex of the baby was and everything like that. It was really cool. One of my early jobs was I was taking blood pressure cuffs and weighing, the moms and things like that. But when there was a new baby born,
it's just the best.
It's the best. Thank you. Is there anything that I didn't talk to you about that you feel is important for our audience to know in terms of fertility or what you're able to do here for them?
I just want to reiterate that, we do offer the full range of services. We, patients, one of the biggest things is, waiting a long time. One of those things where we think, okay, the right person's gonna come along, and we delay and we delay and we delay. But we have much more success the younger you are when you present for care.
Okay.
And so,
Just don't be afraid. Just
don't be afraid.
go for it.
Come in, have an evaluation. It's okay. We're friendly, and we're here to help. Big misconceptions are that it's going to take a long time, or these needles are so painful. Like a lot of the fertility treatments do require that people have injections, but. A lot of people these days are also injecting like the GLP-1 agonists to lose weight.
People are injecting everything.
Injecting everything. Yeah. So I really reassure them that, listen, millions of women have done this, and you can too. And the egg freezing process takes about 2 weeks of your life. You don't have to take off of work, maybe just one day for the actual egg retrieval. But we do have multiple appointments, about 5 appointments in a 12-day period of time, 20 minutes each, to just do an ultrasound and quick blood work. And that's it. So people tend to come in and go to work, and just
talking
fits
to you makes
into
me
their
want to have
lives.
another baby. I know.
Oh my gosh,
I know.
We're ready.
I know.
We're ready.
That's ridiculous. I mean, my youngest is graduating college, but thank you so much. It was lovely to visit with you. I really appreciate you inviting me in. Super fun.
Thank you so much.
So if you are on this journey anywhere in the world and you just want a little more information, just reach out to them. I'm sure that they could help you get more information. Go to their website. And thank you. And from my heart to your heart, if you want to have a family, just go for it. Thanks for watching.